Welcome to Indian Immune News. Our guest today is Girish Mehta. He is a founder of Indian Circle for Caring, a non-profit organization which is doing a tremendous work in serving Indian Americans in the New England and now also nationwide as well. ICC also will have a big presence at the upcoming Health Expo on 10th of April at Burlington Marriott Hotel. And Girish will be also one of the speakers there. He'll be talking about elder care at the expo. So Girish, welcome to our show, and thank you very much for our time. And thank you very much for all the work which ICC is doing.
Well, it is our pleasure and a privilege to serve our community. And thank you for inviting to share the thoughts on topic of elder care and how it is very relevant to our community and your particular personal interest in the topic that led me to say, let us prepare and share the ideas with our community.
Okay, so now let's talk, because as we see, look at the demographics of Indian Americans here, and now the population is now, we had that group of population, that demographics of Indian Americans here in the US, they are aging, and the elder care is becoming very, very important. And people have started to talk about elder care. So how ICC is dealing with elder care? What is your mission? And what is the state of affairs of elder cares among Indian Americans here, especially in the New England area?
Yes. So what is happening is that as we have made United States our homeland, during this process, many of us came 50 plus years ago, like myself, and now younger generation is following. And what is happening, the demographics of our community is changing. Now we find a lot of elderly folks in our community, and then younger folks that are simply starting their professional journey. And what we are finding is that the complexity of care is changing, the landscape is changing, and our demographics is changing there because we live longer. And as we live longer, we are faced with the challenges. For example, in my own case, I've been a caregiver for my elderly parents in US. At the same time, last 4 weeks, I've been a care receiver because of my knee surgery that I went through. Mm-hmm. So I have the experience on both sides of the table. And as a organization, we also served many individuals and families through various challenges due to age-related issues, elder care, and variety of other situations. So the topic is quite timely, and the statistics are staggering, and it is truly a confusing area for people to really get their arms around it.
And also, this is also a very scary topic. Nobody wants to talk about aging and the old age, but it is a fact and it is a reality. All of us are going to go through that. So how you are dealing with this stigma, or our people are opening up and coming up and saying that, look, I need some help, and what type of help they are looking for?
So generally, currently the mindset is, when I have a difficulty in front door, then I look for support. And oftentimes that is a little too late, because certain planning and preparation must be done quite well in advance. As you and I went through high school, we had the fire drills. Not that we were expecting fire to take place, but we were preparing in case that takes place. And because of the complexity we are facing, it is truly something that we need to think about, and then begin able to prepare it. So when the situation comes for ourselves or our loved ones, we are better able to handle it well.
Okay. So now, how did the ICC deal during the COVID with this topic, the 2 years?
Yeah. So in fact, it is surprising that just this morning, I received a phone call from somebody in New Jersey. 2 years ago, when she was under COVID, her nursing home in New Jersey told her that we don't think you will survive, so let me call over your parents and your loved ones. And her children and grandchildren were involved in our conversation 2 years ago. And she survived through COVID. And we had a number of situations that required us to use current technology of a Zoom platform for people to give final rites and goodbye to loved ones from all over the world. a difficult situation where family could not visit the member of the community if they were in the hospital. So very many challenges came our way, but fortunately, technology and our partners that support us were very, very available to us. So they had a good heart and good spirits to help us out.
Okay. Now we are sincerely, looking forward to listening to your presentation about elder care at the Health Expo. But just to give some kind of a preview, what are the couple of things you think you'll be talking about there?
So the first of all, how serious this situation is. Because we live longer, 1 out of 4, 25% of us would be on the receiving end or giving end of the elder care, which means that chances are very high that we would be on either side of it, or in some cases, both sides of it over time. Secondly, because of the complexity that is happening and the reasons for long-term care and support needed, such as Alzheimer, 1 out of 3 American may have Alzheimer. And when a person is facing Alzheimer care, they don't know what's going on around them. And their loved ones wants to do the very best. And that offers multiple challenges for a long period of time, and financial burden, resource burden, community support, engagement, loved one support. So it is quite a complex story. And I don't expect that at the end of the day, somebody coming in to learn about it, they would be an expert. But at least the awareness would be enough for them to say, let us begin to think about it. Let us be prepared so that we'll be equipped to handle our journey with grace and dignity. Now,
the most surprising thing is that nobody wants to talk about our own death, but it is a reality, it is a fact. All of us are going to face that challenge. Now, how important is writing the will of before while you are still healthy, while still you have a senses, and what role ICC is playing in that?
Yeah. So when we talk about the will, there are 2 types of things that we need to include into it. The first type of will is called healthcare proxy and a living will. And ICC will have a workshop at this session at Health Expo during which attendees could come in, prepare a healthcare proxy and a living will, which would allow them to decide and share with the family what are their own preferences for their own healthcare as and when time comes. The second part, which most of us are astute about and pay attention to, is what happens with my money. Who does it receive it? How do we minimize the taxes and so forth? So because the second one with the financial will and its implication, it requires an attorney to help with it. So what we do is we guide the individuals and families of some of the things to prepare before they present themselves to an attorney. But as far as the healthcare proxy and living will is concerned, it is our signature initiative from December of 2007. And so far, we have conducted nearly 100 workshops and presentations in 17 states in USA, and will continue to do that.
Excellent. That's great. I think it's a very educational, and we are all looking forward to listening to your wisdom at the Health Expo, and also looking for your workshop. I think it's very interesting that you mentioned that you will have some workshop about the will and the proxy and all this stuff. That's very important. And your last word. So last word to the audience is, please come and join, support Health Expo, and support the wonderful effort Upendra Mishraji and his team is doing, because it is a dedication for them. For a number of years, they've been doing this program, and their selfless motive is to educate our community and empower them. So please come and join us, and we'll make sure this time there is no snow. Thank you. Yes, yeah, it has. We have had sometimes that issue, but it's wonderful to know that despite many times snow, people still came. So this time I think it's going to be wonderful weather, and we will see you then. And thank you so much, Girish. Thank you very much. Nice talking to you. Sure.